Hello, my name is Dr. Isabelle Benard. I'm a general practitioner at the Medical Chambers Kensington. I've been a GP in London for over 13 years. Today I'm going to talk to you about cystitis, which is a very common infection of the bladder and lower urinary tract. This is very common in women. And we think that over a lifetime, about half of women will have suffered at least one episode of cystitis. The symptoms are very well known to those who've suffered them, are a burning sensation on urination, associated with a need to frequently pass urine, and also a pain above the pubis or the lower abdomen, and occasionally the presence of blood in the urine, which is visible. If the symptoms are mild, please increase the amount of fluids that you drink, and hopefully that will clear the infection. But if the symptoms last for more than 2 or 3 days in a row, then please see your doctor to get some treatment. Your doctor will usually ask you for a small sample of the urine to be able to test it for the presence of infection, and then give you an antibiotic treatment to be taken over 3 to 5 days, and that usually clears the infection. Now, it's quite important, particularly, to see a doctor if you get symptoms of cystitis while you're pregnant, or also if you suffer from diabetes, or if you develop a fever as well. Very important to see your doctor early. Because actually the complications of having cystitis, which are quite rare, but if you leave it too late, are an infection that will spread on to the kidneys, which is called pyelonephritis, and also very rarely blood poisoning, but we hopefully treat it much earlier than that. Now, I'm going to give you a few tips on how to prevent cystitis, which are part of your lifestyle mainly, because many cases of cystitis actually follow sexual intercourse. So as a rule, it is very important that you should try and empty your bladder straight after intercourse to flush out the bacteria out of the bladder. It's also very important to drink plenty of water on a regular basis, and you should aim to drink at least 1.5 litre to 2 litres of water every day, and that simply flushes out the bacteria regularly. We now know that it's important not to use too much soap when you are washing the vulva and the perineal area, because it tends to kill the protective flora which is around this region, which is actually very important. It's also quite important to wear cotton underwears, and we know that drinking cranberry juice or even taking cranberry extracts on a regular basis will help prevent infections. It's also very important to avoid being constipated, so having lots of fruit, vegetables and fluids will help with this. Now, we find that cystitis and urinary tract infections are very rare or quite rare in children and men, and in both these cases it's very important that you see your doctor to get investigated. Many thanks for watching this video.